the public forum, you're going to have to filter easily between 15 to 30 liters of blood, and many of you will need to take a toilet break in this next 3 hours. The kidney has 3 main functions. It removes or excretes, it maintains the internal balance, and it produces hormones. It removes and excretes stuff that we don't need or is toxic to the body, such as urea, creatinine, and potassium. And it also excretes excess water. It maintains the internal balance of calcium and phosphate, and also acid and base. And finally, it either produces hormones or converts hormones. It converts vitamin D, which we absorb from the sunlight, into the active form, which is good for our health, for healthy bones. And it also produces erythropoietin, which is necessary for red blood cell production. Knowing these facts, you can deduce then what happens when the kidney fails. When the kidney fails, we are unable to remove waste products or excess fluid, leading to a condition known as uremia, which simply means the accumulation of urea in the blood, and giving rise to the classic symptoms of kidney failure, which is nausea, vomiting, loss of appetite, and tiredness. Fluid retention leads to swelling of the body, high blood pressure, and when the water gets into the lungs, the patient becomes breathless, and this can be a very serious and life-threatening condition. The inability to maintain internal balance gives rise to a buildup of acid, leading to acidosis, and the lack of calcium leads to bone disease. And finally, the lack of hormones gives rise to a lack of vitamin D, and again contributes to bone disease, and the lack of erythropoietin gives rise to insufficient red blood cells and anemia. So here already you can see the risk factors coming out for chronic heart disease. And the lack of calcium gives rise to a series of processes whereby the calcium, instead of being deposited in the bone, gets deposited in the blood vessels. And this is some place where you really don't want the calcium to be deposited. So in chronic kidney disease, the patients develop high blood pressure because of the kidney disease, fluid retention, and anemia. All this stress the heart greatly. The heart has to work much harder in these circumstances and gives rise to enlargement of the heart. With time, the heart undergoes scarring and remodeling, and you get a cardiomyopathy, which is just a technical term for heart disease where the heart is big and swollen. Then sometimes, of course, this will lead to heart failure and sudden death. The traditional risk factors, together with the other CKD risk factors, can also affect not only the heart itself, the heart muscle itself, but also the blood vessels, giving rise to accelerated hardening of the blood vessels and calcification of the blood vessels. This again affects the heart, and it also affects, of course, the blood vessels of the heart itself, not only the muscles, giving rise to coronary artery disease, and again leading to the same outcome, heart failure and sudden death. Or it can affect other blood vessels in other parts of the body, such as those to the brain and those to the feet or legs, giving rise to strokes and limb amputations. So this is how the non-traditional risk factors give rise to cardiovascular disease. What should you do? Of course, you first need to screen for kidney disease, because if you don't even know you have chronic kidney disease, you can't even go forward from there. So people with high risk, such as diabetes, high blood pressure, and those with a family history of kidney disease should screen for kidney disease. Next, you need to identify the cardiovascular risk and then manage the risk. My last 3 slides will show you in brief an overview of how what the targets are and the various management of the various risk factors. It's not meant for you to copy it down, as the next 3 speakers will be covering all these in greater detail. So we'll try to modify lifestyles, habits, such as smoking, diet, weight, and exercise. Smoking, I'm quite sure all of you know what you're supposed to do, and it's a no-brainer. Stop smoking. In fact, if you quit smoking, You can reduce your risk by as much as 30% for heart disease and another 16% for strokes. And this benefit occurs quite rapidly after you stop smoking. In the diet, you need to have a diet, as you can see from over there, in fact, less salt and less fat. And less salt, Pauline will tell you, our dietitian, is really down to just 1 teaspoon of salt a day. And you may think, oh, this is a great lot. But actually, you haven't remembered the tomato sauce, the kwai su mian that you put all the seasoning in, and that is also counted in your salt intake. And in fact, if you reduce your salt intake by 3 grams a day in the US, as they've projected, you can reduce your risk of coronary artery disease and stroke by as much as a third. Weight, some of you had your BMI done outside. I hope you fall within this favorable BMI range. And exercise, where feasible, is always good for the heart. We'd like to modify the traditional risk factors, which are high blood pressure, diabetes, and your cholesterol. And the target blood pressure for people with chronic kidney disease is less than 130/80. I would like to highlight to you that people may frequently need 2 or more medications for blood pressure control. So oftentimes we argue with the patient and say, just give me one, it's okay, just give me one. But sometimes it's not adequate for your blood pressure control. And certain classes of high blood pressure medicines, and Dr. Tan will be explaining to you later on, will be preferred in patients with chronic kidney disease. For diabetes, we have a target HbA1c of less than 6.5%, and sometimes insulin may be required. And finally, for cholesterol, there are various cholesterol levels that we need to target depending on your risk for cardiovascular disease. And the higher your risk, the lower the cholesterol is required. And finally, for CKD risk factors of anemia, we would like to maintain the hemoglobin of between 10 to 12. We use iron supplements and even erythropoietin injections to maintain the hemoglobin. For water retention, we need close monitoring by daily weight and blood pressure, salt and water restriction where required, and we can use medications known as diuretics to reduce or to increase urine output and therefore to reduce water in the body. And finally, to reduce vascular calcification, we need to maintain a good calcium phosphate balance. And unfortunately for uremia, the only way to modify this is by dialysis or for transplantation. So in conclusion, ladies and gentlemen, what I've tried to do is to show you that the kidneys are actually very much more closely related to the heart than perhaps most of us realized. And people with chronic kidney disease have an increased risk of cardiovascular disease. I'm sorry, this must be CVD, not CKD. The risk of cardiovascular disease increases with the severity of the chronic kidney disease. Chronic kidney disease in itself has its own set of risk factors for cardiovascular disease. And finally, screening and early detection of chronic kidney disease can reduce the incidence of cardiovascular disease. I'd like to end by thanking our sponsors for once again making this public forum possible. Thank you.